You are watching Hot Springs Village Venues.
It's Dennis Simpson with Village Venues, and I cannot tell you how happy we are to be back in the studio after what? Was there a world-changing event that I missed? Was there a pandemic or something?
We did have a pandemic.
Apparently we had something like that. I'm here with Miss Cyrie Wright from KVRE. I'm here with Mr. Carrol Austin from SHIIP, and he's going to remind us what SHIIP is today. Tell us exactly what they do.
Okay, Dennis. SHIIP is the Senior Health Insurance Information Program. By and large, we answer all questions Medicare.
Mm-hmm.
We do free, unbiased, confidential. We're not going to sell you a thing.
But now, let me be clear here. I want to recap just for a second. It's free, and it's for seniors, and there's a lot of deception in those areas sometimes, and people get really confused. Who pays for it?
As far as SHIIP, we are funded by federal grants. Matter of fact, we now have 5 grants that we're funded through that we help people all along the Medicare trail. From 6 months before until 6 months after, and then any questions that arise before or after that.
And I can understand why it's so important, as you say, the Medicaid trail. Oh my goodness, there's so many things to transverse, you know. So you're coming up on 65, or let's say you're in your 50s, and you're just kind of looking at it and going, how do I need to navigate this from here on out? What do we need to know?
One of the things you need to know is it is a 50s thing, and one of the things that I always heard great insurance salesmen, long-term care insurance salesmen say, how old are you? 60. Well, it's too late to think about long-term care. It's too late to think about retirement preparation. In essence, it's not, but you're going to be a whole lot better served if you know where you're going at 50 than you try to run in at it at 63 or 64.
Right. Well, I hear a lot of people talk about, nowadays 65 as a Social Security cutoff, Cyrie, we've heard that for decades,
Yes, for sure.
Well, now they're actually seeing, okay, do you want to defer that to 68 or whatever? Well, how does that affect my Medicare?
The Medicare starts at 65. You're automatically given Part A, and we'll discuss that in a little bit. And then you either have to enroll or disenroll, which is not in the English language, from Part B to keep you from accepting those services.
From Part B. But Part A
is given to you by the government. That's what you pay. If you look on your pay stub, when it says 7.65% Medicare,
right,
that's what you've paid all these years is the hospitalization insurance.
Wow.
Part B is everything else, and Part B was an actual afterthought when the Medicare program came in. Initially, it was simply a hospital indemnity plan that paid you when you went into the hospital, and as they went down the road, they thought, there's other fees that these people are being charged.
Mm-hmm.
And then the other side of it was, they came in even further, and they found out, hey, the better we take care of them before they get to the hospital.
Oh, yeah.
So that's where your doctor's insurance would come through that, and all those other things that are within Part B, those things are captured there. And that's when you hear somebody say it's the 20%.
Yeah.
And that's what's coming out of your cost now. You buy that Part B through a premium, and then it's 80-20 after that.
Okay, well, let's take a
regular
look.
Insurance.
Yeah,
Just like
exactly,
regular
to reimburse. Let's take a look at what Part A really covers.
Part A is simple. I mean, you get that when you turn 65. The easiest way to look at it, and it's the best way I've ever heard explained, when you're in that hospital room, it's paying the rent on that hospital room. Okay? The other thing it does, it entitles you to 2 quarts of blood, or 2 pints of blood, excuse me. And I don't know how they came about with that number, but that is it.
Is this like an oil change?
No.
Well, do you want synthetic or you want?
Chances are, if what is 2 pints,
what's that,
once
a quart?
you get past that, yeah. Once you get past that, you're in serious need of blood.
I think so.
And the other benefit that comes through it that people do tack on to it is the hospice benefit, and that was a little bit later, and that's an end-of-life thing when things can be the most expensive. So it does provide a hospice benefit on the Part A, portion of Medicare.
Okay, let's take a moment and look. We're going to be off camera, of course. Let's take a moment and look at what is covered by Part A: hospital care, skilled nursing facility care, short-term nursing care, home health care services, hospice, semi-private rooms, meals, general nursing, drugs as part of your inpatient program, and other hospital services and supplies. Well, what's not covered? Doctor visits, which as we know can be very expensive, more long-term nursing care more than 100 days, private duty nursing is not covered, a private room, unless medically necessary, is not covered, and television or phone in your room if there's a separate charge, personal care items, razors, slippers, etc. Any hospital expenses beyond the 3, 2. Any hospital expenses beyond the lifetime reserved days. Now, Carol, as we saw in the graphic there, that explains what we're really looking at and why. But you said there were other things that are incident. Is this once a year, or is this
No.
really?
There is a deductible that goes with the Part A, and it's expensive. You know, if you don't have a supplemental coverage to help you pay that. The other part about it is it cannot just happen once a year. And this is a good for instance. This year we had somebody break their arm on the ice.
Right.
Okay. As long as they're going into the hospital for that same treatment,
Oh.
there's not another deductible.
As long as it's associated with that initial
That
event.
first event.
Okay.
Per incident.
Turn around and you turn around and ended up in the hospital last October with COVID. That's a second event. And that arrives at the second deductible that you would have to, be responsible for.
So let's cut to the chase here. There are, and the reason we talk about this service being free, that SHIIP and the federal government provides, is because there's a lot of services that independent insurance agents provide that are not free, and they provide like bonus coverage that sees the donut hole or looks around this? Or?
That goes into Part D, but as far as Part A and B are concerned, that's where you have the Medicare supplement that you can have that will assist you with the cost of out-of-pocket expense beyond the cost of Part A and beyond the cost of Part B.
Well, let's go into what exactly is covered in Part B.
Part B is everything that is not associated with that hospital bed.
This
So it all goes back to the
doctor
bed.
that comes in, the nurse that
room.
comes in, the therapist that comes in, anything that's not tied to that bed is tied to Part B. But remember, Part B is only going to pay 80%. So that
Okay.
still leaves you responsible for the other 20%.
And that could
And
get
the
significant, of
deductible.
course.
That can.
I'm sorry, Cyrie.
I said, and the deductible per
And-
incident.
And the big thing to look at that would be, as you're going through that, that starts to add up. When you look at that, and that's the reason you do see, and I was in that field, senior insurance guys come out and they are pushing the med supp, and they're pushing another product that we're going to talk about later, which is Medicare Part C, which is the Medicare Advantage plans.
Okay.
Those are the all-in-one things that are out there that we'll touch later, but folding it back into Part B is also something that's optional to a point.
Okay.
You're given Part A.
At
You have
65, I
at
get Part A.
65. They also will offer you Part B.
Okay, but I don't have to take it at
No.
65.
No. As long as you maintain credible coverage, you're okay. Or if you want to be self-insured for Part B, knock yourself out.
Really?
Go have that first physical after the first of the year.
Yeah.
And just see how far that 80% went, and when you get that 20% deductible back, how much
Yeah.
it's going to cost you, or the total out-of-pocket expense that it would cost. So, it's really important to understand what Part A and Part B cover, and then what you're liable for beyond that. But Part B was an afterthought to Medicare. They saw these people, and then the other side that they plugged into that was the preventative medicine. So preventative test or whatever they can do to make sure they're catching a disease early, they're going to want to do that.
So
and both
when-
Cyrie and I'm a
Yes, you are.
caught it early person
Yes,
from that.
Definitely.
Well, and thank the Lord, right?
Yeah.
Well, and Part B, you said it's voluntary up to a point.
Up to a point, because you have what's called enrollment periods.
Right.
Okay, if you do not take your Part B and you defer it, that's fine.
Sure.
You're going to be responsible for those costs.
Okay.
The entire cost. Not only are you going to be in charge of the 20, you're going to be in charge of the 80.
That's the 100% cost.
Yeah.
You just added.
I can
You
add.
added it to the 80 and the 20, and it became 100% out of your pocket. The other thing that you can do is, as long as you're on like a spousal insurance policy and you have that credible coverage, and that credible coverage will come back again when we talk about Part D. But as long as you have that, that's the time that you do not have to have Part B.
Right.
You leave a job or you get off your spouse's insurance. At that point, you have 63 days, basically, to get everything straightened out, and two, that's also starts your guaranteed issue right for a Medicare supplement. So it's real important to coincide a lot of these things together.
What do you do, Dennis, at the federal government? Well, I actually calculate the 63 days that you have when you get rid of Part B to when you have to pick up Part. No, I find it
And
funny that
it's
everything
not
has
funny,
a
but it is.
Yeah.
exactly everything has a unique number.
Yeah.
And you'll see 63 days
Yeah.
2 or 3 times in the Medicare system.
Really? It's
So
just
there was somebody that, a lot of times they want to say we're giving you 2 months.
yeah.
Well, The most 2 months can ever be is 62.
Right. So
July and August.
Here's the one more just
yeah,
in case.
Yeah, and so they give you that extra day.
Well, let's look at what Part B covers here. The Part B coverage summary is it does cover annual physical exams, laboratory tests and x-rays, blood work, medical equipment, wheelchairs, hospital beds, orthotics and prosthetics, mental health care, and ambulance services. Now, what it does not cover is long-term nursing care for more than 180 days, acupuncture, naturopathy?
Yes.
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 Routine foot care, cosmetic surgery, hearing aids, dental care and dentures, and care outside the U.S. So if you're in Mexico or whatever, right?
And that's right. And that's also one of those things that if you're in the supplement realm,
Mm-hmm.
you know, a lot of your supplements have a out of the United States coverage.
Right.
It may not be 100%, but you do have some coverage when you go outside the United States.
Interesting.
Can I back you up for just a
Sure,
second,
please.
Dennis? On the Part A, you have the first 100 days is covered. When you get to that 101st day, that's when you start paying.
Right.
And a while ago, when we were going over the not covered issues in Part B, the long-term nursing home care is not covered for more than 100 days.
I
and
got you.
not 180. So I just wanted to clear that up
And
real
that's pretty
quick.
good because the reason that's in there is hospitals don't keep you any longer than they have to anymore.
That's
Right,
right.
right, right.
They're
And
ready
if
to
you
kick you
can go
out.
into a nursing home, a skilled nursing home, you have to have that skilled care need. You can go into the nursing home for those 100 days to recoup. And when you do that, in order for Medicare to cover that, you have to go from that hospital to a certain facility within 3 days of discharge.
Oh, really?
Right. You don't go home and recoup and say, "Oh, this isn't for me."
And then
You know,
try it, yeah.
and in most cases, the doctors and the discharge planners, they know well in advance that, you know, we're going to move you out of hospital into some sort of rehab setting.
It's so funny you should
Yeah.
say that. My aunt's literally going through that right now. She's 98 and lives in Conway, and they were like, well, it's coming up to that 100-day threshold, and I'm like, oh, okay. So this really explains a lot.
At
As-
101 days, things change.
Yeah,
Right.
things change a
Life
lot.
change.
And that's
Changes.
also where, you know, we would go into probably the next taping where we talk about Medicaid.
Yeah.
That's where you're either
Yeah.
at 101st day, either you're private pay or you do have long-term insurance or you're on a spin down to where you do qualify for the state assistance, which
Oh.
would be Medicaid.
Okay.
So that's just a long story, and those 100 days go by quick.
And Carrol and Cyrie, thanks for joining us today on Village Venues. That was our Part A and Part B segment. We'll be back shortly with Medicare, with Medicaid, and we will also cover Part D in an upcoming show. So it's great to talk to you, and we'll be back soon.
Thank you for watching Hot Springs Village Venues. Please stay tuned and follow us on Facebook to see the next episode.